भी स्ट्रेस हुआ है ना।
रुको रुको भी नहीं करना 2 मिनट रुको नहीं करना वीडियो अब म्यूट ही रहने देना आवाज नहीं आती है क्या लगना क्या है
Then I have made you the host.
Yeah, thank you.
Welcome.
Anaga, so she have already made me the co-host. So you want me to be here? We'll stay here only then.
Yeah, we can be here, and she has Nana. You are the host right now.
Yeah, I have made you the co-host.
Okay, you okay, okay. But I think later on you'll have to make Andrea the co-host.
Yeah, I'll make Andrea. We have that option. We can make co-host for many people.
Okay, yeah. So once she joins, then you can make her the co-host. Okay.
Yeah, so I'm just sharing that message wala part.
Hmm.
So is this not मतलब ये अनगा ये वाला जो मीटिंग है ये मतलब इन करने के लिए नहीं है क्या लोगों को people directly joins?
Yes, I think so. That's the case. So um we'll have to see who all are joining basically.
ठीक है.
But that's okay. Okay, let the people join.
Sure. So Anaga have मतलब मैंने changes किए हैं for the message. It will only be seen to host and co-host. ठीक है? Can you
Okay,
ask Andrea to join so it will be easy
Yeah,
for us?
I've already told her to join. Yeah.
Yeah, and also can you ask Nimrata to join as well so like I can explain her
Yeah,
as
I'll
well.
do that.
Like who
Yeah.
is going to give her the question and everything.
Yeah. Naina, Andrea is not receiving my calls. So can you try once calling her?
Okay, and even if she is not, then let's handle this by Anaga. Let's not
Yeah,
wait.
that's okay.
Yeah, just share the question wala link with me. I'll start adding that. But who will be giving to this Nibrata?
I'll do that. So that's
ठीक है,
not a
चल,
problem.
done.
ठीक
Done,
है.
done,
Okay.
done. Let's people join. We'll wait
Yeah,
for
yeah.
6 minutes.
Yes, because there are other people also joining. So we'll wait till 3, 5.
ठीक है, done.
Okay. Hey, hi, Nimrata. Hello,
Hi,
Nimrata.
Nimrata. Naina here. Hear
Dr.
us?
Nimrata, are you able to hear us?
Yeah, I can. Hi, guys.
Nimrata? I don't think she can hear us. Hi, Nimrata, can you hear us?
Yes, Anaga, I can hear you. Can you hear me?
Yes, we can hear you now.
Okay, great. So now I can hear you. I think we're on the same page.
Yes. So we'll be waiting for another 5 to 7 minutes so
Sure.
that more people can join in, and then we'll give you a heads up when to start. Okay?
Great. Thank you.
Yeah, thanks.
Hello, ma'am.
Good afternoon, ma'am.
We'll start. Good afternoon, everybody.
Hello, ma'am.
Hello, everyone.
Good
Just give us
afternoon.
a couple more minutes to begin this session. We're just waiting for everyone else to join in. So just probably another couple of minutes before we head into this really interactive and interesting session.
Yeah, it's okay, ma'am.
Yeah, I think post lunch time, right? Most of us would be, just finishing the motherly duties and then getting ready for this.
Hello everyone, there is a little request I have before we get into the session, and the request is if everyone can make sure to be mute and even switch off your cameras if needed during the session. You all can have your cover picture. It's okay if you all switch off your cameras, and of course keep yourselves mute during the session. Any questions can always be put in the chat box. So there is no need for anyone to unmute themselves because we get unnecessary disturbance in the recording of the session.
Yes, I would completely agree with Dr. Nimarta as well. Guys, it's a request that you can please be on mute. You can also turn off your videos. We'll be giving you all a good 15-20 minutes while we end the webinar, and at that time you can definitely put your videos on, and as Dr. Nimarta also mentioned, you can start putting your questions, your queries in the chat box so that Dr. Diksha would be answering all the questions and all your queries at the end of the session. Okay.
Anaga, can we start? It's already 3:08.
Yes, Nana, just we can wait for another 1 or 2 minutes, and by 3:10 exactly we can start off.
Okay.
Yeah. So Dr. Nimarta, you can start off at 3:10. Exactly at 3:10 we can start off. Okay, so I have a request to say the same thing in Hindi. Okay. So मैंने अभी वही बताया कि आप सभी वीडियोस बंद रख सकते हैं एंड स्पेशली म्यूट पे ही रहना है आपको, क्योंकि इस वेबिनार के एंड में आप सबको 15 से 20 मिनट दिए जाएंगे जहाँ पे डॉक्टर दीक्षा आपके सारे क्वेश्चंस और क्वेरीज को आंसर करने वाले हैं. सो पूरे सेशन के टाइम पे आप सबको वीडियोस बंद रखने हैं एंड म्यूट पे रहना है सो दैट कोई डिस्टरबेंस ना हो बेसिकली जो वेबिनार होने वाला है उसमें. एंड आपके जो भी क्वेश्चंस है आप चैट बॉक्स में डाल सकते हो, आप मैसेज कर सकते हो सो दैट हम वहीं से ही आपके क्वेश्चंस पिक करेंगे एंड डॉक्टर दीक्षा विल आंसर इट एट द एंड. ठीक है. So Nimarta, I think we can start in a minute. Yeah.
So once again, I feel elated to be a part of another Zoom meeting, which is going to be informational as well as eye-opening for a lot of women out there. Thanks to an esteemed doctor who's on the panel with us today. BabyChakra and Sirona have come together and have decided to highlight a topic which is always hush-hush among women, no matter how modern we get. There are a lot of us who still are skeptical about talking or putting across their point of views or thoughts or even asking doubts regarding periods, menstruation, and the things associated with it. And today we are here as women, as moms, as sisters, as daughters, as doctors, as influencers to break this taboo. And I'm glad that Sirona and BabyChakra have joined hands with this initiative today. I am Dr. Nimarta Bindra. I am a dentist by profession and a mom influencer as well. Many of you know me as the Momster. And today I'm here to welcome Dr. Diksha Chadda, who's MD in Preventive Medicine. And she is the absolute right person to be guiding us correctly on our webinar today. So welcome, Dr. Diksha.
Thank you so much, Dr. Nimarta.
So glad to have you with us today. You look so lovely and you look so warm and welcoming that I'm sure questions are going to be easily flowing from my end. I need everyone else to be on mute. Prachi, Radha, there are a lot, Neha. I can see a lot of you still unmuted. We need you to be on mute. म्यूट पे जाना बहुत जरूरी है. नेहा, प्राची, अभी भी मुझे बहुत लोग दिख रहे हैं जो म्यूट पे नहीं है. प्लीज make sure that आप mute पे हो, वरना ये session में बहुत disturbances होंगे. So hello, Dr. Diksha, how are you doing today?
I am doing very well, and honestly, I've been so excited for this session. चल रही है. So I think Prachi is still unmute. Okay, now
She
she's
is
unmute.
muted now. She's muted.
So I'm really looking forward to this.
So see, the first question that comes to my mind is, nowadays we're talking about eco-friendly, we're talking about conservation, we're talking about sustainability. But I think one of the things that most of us are really not aware is, what is this what is this the concept of sustainable menstruation? I'm reading a lot about it, I'm hearing a lot about it, but I would like you to explain it to every layman out here. What exactly is sustainable menstruation?
Absolutely. I mean, sustainable menstruation, I think एक ऐसा word है जो मैं daily कहीं ना कहीं इसके बारे में बात कर रही होती हूँ. And before I go ahead, can I ask whether I should be strictly English?
I think we should do English because there are a lot of people here who are requesting Hindi. तो अगर आपको लगता है कोई important reinforced point को reinforce करना है, we can probably repeat it in Hindi. But a basic English conversation should be okay.
Okay. So sustainable menstruation as a concept, I feel in India, in our basic roots, we and especially women and our culture always has respected the environment. हम हमेशा ही अपने वातावरण की, हमारी पृथ्वी की हम पूजा भी करते हैं और हम उसको हमेशा कंसिडरेशन में लेकर चलते हैं, कोई भी चीज हो, चाहे वो फेस्टिवल हो, चाहे हमारी डे टू डे लाइफ हो. So sustainable menstruation is not a very scientific concept or difficult to understand. What we are just talking about is that whatever behaviors we adopt or whatever products we are using, us as women, for managing our periods, they should be sustainable. And sustainable in terms of two things: sustainable for my planet and sustainable for the pocket, both. So all the products that we are using, whether it's sanitary napkins, cloth pad, menstrual cups, anything, the product we should always keep in mind whether we are doing this in a sustainable fashion, ताकि ना तो मैं वो प्रोडक्ट यूज करूं उसमें कोई ऐसा पॉल्यूशन कॉजिंग एजेंट हो जो कि मेरे एनवायरनमेंट को हार्म करे. फॉर एग्जांपल, ज्यादातर सैनिटरी नैपकिन्स जो कि आम कमर्शियल सैनिटरी नैपकिन्स हैं, they contain at least one sanitary napkin has at least 4 plastic bag equivalent of plastic in it. And second, उसके अंदर जो absorbent डला होता है, that's called super absorbent polymer, which sucks in a lot of water. So हम जब pads को wrap करके throw कर देते हैं डस्टबिन में, we never realize that उसके बाद वो कहीं ना कहीं landfill में जाता है, किसी water body में जाता है, and वहां से water suck करके काफी सीवरेज सिस्टम को भी नुकसान करता है. एंड अगर बर्न कर दिया जाता है इंसिनरेटर में या अदरवाइज, तो उसका जो प्लास्टिक और पेट्रोलियम प्रोडक्ट्स होते हैं वो अल्टीमेटली हमारे एयर पॉल्यूशन को ही बढ़ाते हैं. सो वन इज द डैमेज दैट इज बीइंग कॉज्ड टू द एनवायरनमेंट, एंड सेकंड ऑफ कोर्स इट्स अ प्रोडक्ट व्हिच वी हैव टू कीप बाइंग repeatedly, and it does cost the pocket if you are trying to buy sanitary napkins each month. So when we talk about sustainable menstruation at Sirona and Sirona Hygiene Foundation, we talk in terms of products and choices that we can make which are sustainable for our planet and something which is reusable, so that हम एक ही चीज को काफी सालों तक यूज कर पाए, रीयूज कर पाए. और हमारे घरों में हमारी मदर से हमने सीखा है कैसे एक जार भी अगर आ जाता है तो उसको हम किस तरह से धोकर ग्लास के जार को रीयूज करते हैं. तो इन अ सिमिलर वे अगर हम किसी प्रोडक्ट को रीयूज कर सकते हैं तो व्हाई नॉट. एंड रीयूजेबिलिटी अल्टीमेटली हमारी पॉकेट के लिए भी अच्छा हो जाता है और प्लैनेट के लिए भी.
So basically sustainability का मतलब यहाँ पर ये है कि आप वो चीजें इस्तेमाल करें which are not really affecting the environment, are eco-friendly, are friendly to your pocket, are reusable, and basically in the good of humanity, in the good of everything around us. When जब हर जगह plastic ban किया जा रहा है, तो why not here, which is something which hundreds of women are using on probably a daily basis. So it's like one of the things that is ignored, and जबकि वो इतना ज़्यादा pollution cause कर रही है in the long run. So the next question that I have for you is that what pads are the only way. Probably people were using homemade napkins, but we had never ever heard of menstrual cups, and now they're all talking about menstrual cups. So what is this exactly?
Okay. Nimrata, I hope my video and audio are still audible, because while you were
Yes,
talking,
yes, you are.
there were some gaps. So first of all, I'm audible. Okay. So menstrual cup in my hand right here is a very innovative product, and I think बहुत लोगों को जान के आश्चर्य होगा that this is not something जो कि बहुत नया है. शायद हम लोगों ने नया नया देखा है, but ये 19th century से यूज हो रहा है. 1837 में इसका इन्वेंशन हुआ था, and the person who invented it was a Hollywood actress. Her name is Leona Chalmers. So एक
Wow.
औरत ने ही इसको इन्वेंट किया. So and this product, इसका बहुत साल लगे इसको ऐसे मेन स्ट्रीम आने में, बट अब काफी सालों से यूरोपियन कंट्रीज में और अफ्रीका में तो नेशनल प्रोग्राम्स में भी ये यूज हो रहा है. सो इट्स अ डिवाइस विच इज मेड अप ऑफ मेडिकल ग्रेड सिलिकॉन. ये देखने में कई लोगों को लगता है कि शायद प्लास्टिक होगा, बट दिस इज नॉट प्लास्टिक. अ मेंस्ट्रुअल कप इज मेड अप ऑफ मेडिकल ग्रेड सिलिकॉन, एंड इट इज अ रीयूजेबल डिवाइस जिसको आप फोल्ड करके इंसर्ट करते हैं अपनी बॉडी में, जस्ट लाइक अ टैम्पॉन, and it collects your period flow, and after a certain time you throw away the menstrual flow that is collected in it, wash it and fold it and reinsert it, and so you can reuse one menstrual cup for up to 10 years. I know of women who are using the same cup for the last 12 years also. So at least itne time ke liye you can save the expenditure on the pads also, and then of course it's a very convenient product क्योंकि इसको जब हम use करते हैं we can have a very active lifestyle. चाहे हम playing कर रहे हैं, चाहे हम swimming कर रहे हैं, चाहे हम travel कर रहे हैं, या डे टू डे लाइफ में बहुत सारी फार्मर वुमेन ने भी हमें ये बोला कि अगर हम बैठ के खेती भी कर रहे हैं तो इट बिकम्स अ वेरी कन्वीनियंट प्रोडक्ट, और आपको भुला देता है दैट यू आर ऑन योर पीरियड्स.
Interesting. So I'm sure there are now a lot of questions in people's mind. मतलब आपने triggering एक चीज दे दी है जिसपे I'm sure a lot of people have a lot of doubts. So let's take it step by step. सबसे पहला question I think most of us must be really worried about is how safe are menstrual cups, because this is not something that everyone is using. Pads हमें बहुत टाइम से पता है what are they and how they're supposed to be used. तो menstrual cup एक ऐसी चीज हो जाएगी कि how safe is it? There is a question related to that also. I will take it now only because it's in continuity, but पहले let's hear from you about its safety.
Okay, so just like you asked this, so जब मेरे को भी first time menstrual cup के बारे में पता था, as a doctor, even my concern was about the safety. So when I heard about this product, of course, क्योंकि हमें पढ़ने का बहुत शौक होता है ना डॉक्टर्स को, so first I opened up the books, then I opened up a lot of literature to understand what others have been saying, what research has been done about this, and I found out through research that there was a study published in a very respected journal called The Lancet, where they had done a study on the safety of this product, and they declared it to be extremely safe basis historical data of 30 years of use of menstrual cup by people. So बहुत ही safe product है research के मुताबिक भी, और logically speaking also, the material that it is made up of, medical grade silicone, it's the same material which is used in medical devices in the hospital. For example, if you have delivered in the hospital, you might know कि एक यूरिनरी कैथेटर भी इंसर्ट किया जाता है कई बार लेबर से पहले. तो आपकी बॉडी में मेडिकली कोई भी प्रोडक्ट अगर इंसर्ट हो रहा है या बॉडी में ऑपरेशन के टाइम भी कोई चीज यूज होती है, वो हमेशा एक मेडिकल ग्रेड सिलिकॉन मटेरियल की बनी होती है. इट्स इनर्ट मटेरियल, इट डजंट कॉज योर बॉडी to react, so it's a very safe material to be used. So both scientifically speaking, logically speaking, this is very safe, and मैं खुद अब 4 साल से ज्यादा से यूज कर रही हूँ, so I can vouch for it that it's extremely safe.
Wonderful. So now there's someone who's asked a question, because we're talking about safety and this is slightly related to it. So can unmarried girls also use menstrual cups? Will it affect their virginity, or how does it work?
So you have hit a topic which I love talking about. So माफ करना अगर ज्यादा लंबा बोलूंगी तो इस पे. So two aspects here है ना. एक हमने बात कर दिया अचानक से virginity की, and second we are talking about whether unmarried girls can use it or not. So दोनों चीजों में थोड़ा सा एक तो आज की डेट में डिफरेंस भी है. सेकेंड पहला पार्ट आंसर कर देते हैं, कैन अनमैरिड गर्ल्स और यंग गर्ल्स जिनकी अभी प्यूबर्टी शुरू हुई है, कैन दे यूज इट? यस दे कैन यूज इट. इनफैक्ट अफ्रीका में स्कूल हेल्थ प्रोग्राम्स में, ताकि गर्ल्स स्कूल छोड़ ना दे, कप्स ही डिस्ट्रीब्यूट किए जाते हैं. मेंस्ट्रुअल कप्स की वजह से ही वहाँ के स्कूल ड्रॉप आउट रेट में फर्क आया है और लड़कियां स्कूल जा पा रही हैं. तो इट्स वेरी सेफ. If you look at the other Western countries, whether it's America or Canada, most often वहाँ पर तो sanitary napkins भी use नहीं होते. वहाँ पर भी हम एक insertional product use करते हैं which is called tampon. So as soon as a girl has a puberty, she would be handed a product called a tampon, which again is inserted. So insertional products are safe to be used even by young girls who have just started with their puberty. Now, second question that you have asked me is about virginity. तो virginity होती क्या है, राइट? एंड क्या मैं एग्जामिनेशन से या वेजाइना को देख के बता सकती हूँ कि कोई लड़की वर्जिन है या नहीं? जरूरी नहीं है, ठीक है. जस्ट लाइक एक लड़के को एग्जामिन करके नहीं बताया जा सकता, ऐसे ही एक लड़की को एग्जामिन करके आप 100% गारंटी से ये नहीं बोल सकते वेदर दिस पर्सन हैज हैड सेक्स और नॉट. ओनली वो आपको ट्रुथ बता सकते हैं अपने मुंह से, अगर बताना चाहें तो, राइट. एक कॉमन मिसकंसेप्शन है कि अगर बॉडी में हाइमन प्रेजेंट है तो द गर्ल इज अ वर्जिन, एंड अगर वो हाइमन मिसिंग है दैट मीन्स शी हैज हैड सेक्स. और हाइमन होता क्या है ये बताने के लिए आई जस्ट ब्रिंग दिस मॉडल. दिस इज अ लाइफ साइज मॉडल ऑफ फीमेल एनाटॉमी, यानी कि मेरे शरीर में जब मैं प्रेग्नेंट नहीं हूँ, एक इंडियन औरत के शरीर के अंदर सारे अंग, सारे ऑर्गन्स वुड बी ऑफ दिस साइज अप्रोक्सीमेटली. सो दिस इज द यूट्रस और द बच्चेदानी. दीज आर द फेलोपियन ट्यूब्स ऑन बोथ साइड्स. ये ओवरीज या अंडाशय है, ये सर्विक्स, ग्रीवा. दिस इज माय वेजाइनल कैनाल, योनि का रास्ता, एंड दिस इज द वेजाइनल ओपनिंग, एंड बाहर ऑफ कोर्स वल्वा के लिप्स होते हैं, राइट. सो हाइमन क्या होता है? हाइमन इज नथिंग बट अ फ्लैप ऑफ स्किन और टिश्यू which is present somewhere either all around the vaginal opening or just towards one end in a very half moon like shape. So it's just a tag of skin which is very delicate and it can break away even before a girl hits puberty. हो सकता है प्यूबर्टी आने से पहले ही हाइमन टूट जाए. तो ऐसा जरूरी नहीं है दैट ओनली सेक्सुअल इंटरकोर्स विल ब्रेक दिस हाइमन. बहुत लोगों में ऐसा होता है कि इवन एट द टाइम ऑफ प्यूबर्टी दिस इज नॉट प्रेजेंट एंड इसका पर्पस ही टूटना है. अल्टीमेटली दिस विल गेट ब्रोकन वेदर बाय नॉर्मल प्लेफुल एक्टिविटी और बाय लेटर ऑन बाय सेक्सुअल एक्टिविटी. एंड बल्कि कई लड़कियों में ये इतना इलास्टिक होता है दैट इवन आफ्टर हैविंग सेक्स hymen will still remain intact. तो hymen की presence या absence is not equal to virginity presence or absence. तो एक ये myth हम आज बिल्कुल clear कर देते हैं कि hymen से virginity का रिश्ता overhyped है और कहीं ना कहीं as general lay people हम लोगों को उस पर जजमेंट नहीं करनी चाहिए. एंड सेकेंड, क्या यंग बच्चे यूज कर सकते हैं? तो बिल्कुल कर सकते हैं. और अगर यंग गर्ल्स को पीरियड्स में मेंस्ट्रुअल कप्स यूज करना है, they will use this size. So they will be using this small cup size. I was showing you the medium cup size earlier. So for young kids, you have a smaller size because their bodies are different. Their bodies are smaller. So they can safely use the softer and smaller cup.
Great. Okay, so let's coming to the next question, because you spoke about a small size and a larger size. So obviously there is a variation in flow as far as women are concerned. So my next question would be about heavy flow in menstruation, जो बहुत ladies का या बहुत girls का बहुत एक common problem है. So before we who face heavy menstrual flow, what is the reason? Is it okay to have heavy menstrual flow? What can you do to avoid it? Just something that you can highlight.
Absolutely. Another very common question, whether I'm sitting in my clinic or whether I'm out there taking sessions, this is one question which a lot of women ask. What is normal? How do I know whether I am normal? And most often what I have observed is that women either tend to compare themselves with their friends and sisters कि हाउ आपके कैसे पीरियड्स हैं और मेरे तो ऐसे हैं, तो मैं नॉर्मल हूँ या आप नॉर्मल हो, कंफ्यूजन हमेशा रहता है. एंड देन सेकंड, They also tend to compare themselves with their past. पहले मेरे periods ऐसे थे, अब अचानक से ऐसे हो गए. So two things. One, every woman is different. So don't compare notes with your friends or siblings. And second, even in your own life cycle, from puberty to menopause, your periods are going to show a lot of variation. And you must have observed that already. यहाँ पर बहुत सारे mothers हैं. So you must have seen before delivering the baby, after delivering the baby, there are so many changes. So the normal keeps changing. So how do we know when to see a doctor? How do we know what is not normal, right? So again, quickly, I'll go back to this. So this here, which you see, the uterus has inner layers called as endometrium. So every month, why do we have periods? Because at the beginning of every month, when we are bleeding, after the bleeding is done, what our body does is, under the influence of hormones, ये ovaries कुछ ऐसे hormones release करती हैं अंडा release करने से पहले, जिससे इसकी layers अंदर की तरफ से, मतलब बच्चेदानी के अंदर जो layers होती हैं वो मोटी होती जाती हैं. ऐसा क्यों होता है? Just like अगर एक पक्षी अंडा देने वाला होता है, if a bird is about to lay their egg, they build a nest. वो एक layers का nest बनाता है egg को comfort देने के लिए. इसी तरह से similar to that, not exactly like that, but once our ovary is about to produce an egg, the uterus also creates a sort of a nest. It creates layers in which, if there is conception, that baby will be implanted. But if there is no pregnancy, then these layers have no role, and these layers are just shed. So the blood that you see in your menstrual cycle, that's actually the endometrial layer which is coming out. ये मैं अभी फ्लो के रिलेशन में क्यों बता रही हूँ? बिकॉज ये लेयर जितनी थिक होंगी, आपकी ब्लीडिंग, आपका फ्लो उतना ज्यादा होगा, उतने ज्यादा ड्यूरेशन का होगा, उतना हैवी होगा. और ये लेयर्स जितनी पतली होती जाएंगी, उतना आपका फ्लो कम होता जाएगा. और ये चीज कैसे डिसाइड होती है? सिर्फ इन हार्मोन्स से. ये हार्मोन्स वो मैसेंजर्स हैं. दीज हार्मोन्स डिक्टेट हाउ थिक योर एंडोमेट्रियम विल बी. ये कितना मोटा या पतला अंदर से होगा, एंड उस अकॉर्डिंगली आपका फ्लो होता है. सो आई वुड से if your flow in terms of duration is less than 3 days or more than 10 days, you need to see a doctor. Second, if your flow is so heavy that you need to change pads every hour or 2 hours, then definitely you need to see a doctor. And third, if you ever have bleeding in between your cycle, हमारे cycle की एक duration होती है, वो 24 days भी हो सकती है, 45 days तक भी हो सकती है, कि हमारा साइकिल इतने दिनों बाद दोबारा लौटता है. अगर उसके पीरियड के बीच में कहीं पर आपको फिर से ब्लीडिंग हो जाती है, या इसमें बहुत मोटे क्लॉट्स आते हैं, थोड़ा बहुत क्लॉट्स आना और जेली लाइक चीजें पीरियड ब्लड के साथ निकलना इज नॉर्मल, बट बहुत मोटे क्लॉट्स और टुकड़े जिनको कहा जाता है, अगर वैसे देखने में कुछ मिल रहा है, then you should definitely consult your doctor. So I hope this explains why some women have very heavy flow and some women have low flow, because जैसे जैसे our hormones will change, the endometrial thickness changes, and accordingly your flow also changes.
So do you think people should take medications for a heavy flow or just consider it normal?
Okay, so like I said, the normal range is that if your periods are anywhere from 3 days to, let's say, 7 days, this is absolutely normal. Anything beyond that, or very heavy flow in which you have to change pads after every 1 hour, you should see a doctor, not take medication on your own, because you will not know what medication to take, and also because the doctor needs to diagnose where the problem is. The problem could be in the reproductive hormones, estrogen, progesterone and related hormones, जो आपके reproductive system के hormones हैं, or problem could be there in your thyroid hormone or some other bodily process. So problem identify करना doctor का काम है. So you can just identify when I need to see a doctor, and then let the doctor judge what medication needs to be given to you.
Okay, so now there's another question. I'll link it here because someone is asking me, can I use menstrual cup for blood clotting as well? Is it helpful to hold blood clots? So are you asking about menstrual blood clots or blood clots in general? I'm not getting the question. If you can understand the question and take it.
Okay, so I would answer this like this, that some amount of clotting in the sense that थोड़े छोटे छोटे few centimeter धब्बे आना या jelly like blood आना या stretchy blood आना is okay, that's normal. But if you see coin size clots or bigger in size, then it could indicate some other problem. It could be some blood disorder, or it could be that कोई pregnancy थी जो miss हो गई, and somewhere जो products of conception है वो टुकड़े टुकड़े होके आ रहे हैं. और खासकर अगर इस तरह की clotting आपने MTP pill ली थी या I pill ली थी और उसके बाद आ रहे हैं, तो you definitely need to see the doctor about it. Cup can be used or not has nothing to do with it. आप कप कभी भी यूज कर सकते हैं फ्लो मैनेज करने के लिए. जैसे आप मेरे से ये नहीं पूछेंगे कि क्लॉट्स के लिए मैं पैड यूज कर सकती हूँ क्या. द पर्पस ऑफ कप इज जस्ट टू कलेक्ट द मेंस्ट्रुअल फ्लो, जैसे कि पैड एब्जॉर्ब करता है. दैट्स इट. कप हैज नथिंग टू डू विद इट. बट इफ यू हैव बिग क्लॉट्स, you should see a doctor, because the clots could indicate something else which needs management.
So another question is, do I wear a cup during the first and second day? The blood leaks. Not sure if the position is wrong, or is there something else that I'm doing wrong?
Okay. So when I have to wear the cup, I'll explain this in very brief, because otherwise the whole hour will go into this. So when I have to use the cup, number one, my hands should be clean. My nails right now are not cut, but when I'm using the cup, they're always cut. Never insert a cup with nails. So wash your hands बहुत अच्छे से. Wash the cup. The cup usually comes with a cup wash also, so you can use that to wash the cup, or you can sterilize the cup. And you are going to fold the cup. So the best fold for new beginners is a punch down fold. So you punch it down like this. I'll show it again. So you punch it down like this, hold it like this, get in a comfortable position, one leg on the toilet seat or a stool, or squat down. You bring this cup to the vaginal opening and push it in as far as your fingers will allow. And then you take it out. Most of the time, the cup will open on its own. But sometimes what happens, because the cup inside your vaginal canal is held in place by vaginal muscles. So there are vaginal muscles covering this, right? So they are holding it in place. So sometimes the vaginal muscles hold it, fold it. और अगर वो अंदर ऐसे folded ही रहेगा, तो यहाँ से flow आ रहा है cervix से, वो cup के अंदर जाने की जगह इस edges से slide करके नीचे आ जाएगा. So if you are observing leakage with your cup, there are just two reasons. One, the cup size is wrong, or the cup placement is wrong. Placement, या तो आपने stem को अभी भी बाहर रखा हुआ है इस तरह से. Stem should not be out. When you're wearing a cup, you don't feel the cup. So if you're feeling the cup, that means cup बहुत नीचे है. Second, the cup should be in place and it should be opened. And the way to open the cup or to make sure it's open is after insertion, just inside, put a finger inside to feel अगर कहीं पे dent है तो. And if you feel कि कहीं पे कोई dent है या cup खुला नहीं, just press on it and the cup opens. So make sure that the cup is open, right in place, and then there should be no leakage.
And how long will one cup work on like an average, suppose like a second day of period?
Same time as your pad.
Pad.
So our flow, we women have very good idea of मेरा flow पहले दिन कम होता है, second day heavy होता है. ज़्यादातर ladies मुझे यही बताती हैं. So अगर आप first day pads 6 घंटे तक रख के उसके बाद change करते हैं, remember any period product you are using, don't use it longer for 8 hours. Whether it's kapda, whether it's sanitary napkin, whether it is cotton, whether it is tampon, whether it is cup, whether it is disc. No period product should be used for longer than 8 hours. Okay. अदरवाइज जो हमारे नॉर्मल बैक्टीरिया हैं, जो हमारे हेल्दी बैक्टीरिया हैं, वो भी उस ब्लड को यूज करके मल्टीप्लाई करना शुरू करेंगे. वी डोंट वांट दैट. सो दैट्स व्हाई इवन सैनिटरी प्रोडक्ट्स अगर हम अनसैनिटरी वे में यूज करेंगे, दे विल कॉज इन्फेक्शंस. सो वी हैव टू अवॉइड दैट. सो उससे लंबा तो हमने कोई भी प्रोडक्ट यूज नहीं करना है. रेस्ट, इफ यू हैव फॉर एग्जांपल यू नीड टू चेंज योर पैड आफ्टर 3 hours generally, so your cup also you can take it out after 3 hours and you can wash it and you can reinsert it.
So we'll take the remaining questions in our last 15 minutes. Let's continue with our discussion. So my next question is, periods ho gaye, heavy flow ho gaya. The next common problem, because most women are either trying to get pregnant or maybe some other thing, or PCOS, PCOD. These are terms that have suddenly become very common. Matlab, now every second person is saying I have PCOD or I have PCOS or I have this, I have that. So irregular periods is one of the commonest term linked to any of these conditions or any woman conditions for that matter. So what is this whole concept of irregular periods? or is it okay to have irregular periods, what to do if you have them, what to do to regulate your periods. So if you can highlight everything.
Sure. So starting with what is a irregular period, because the first time when a lady comes to me and says my periods are extremely irregular, and especially young girls I'm talking about, I always ask them, why do they think it's irregular, right? For the young girls, I've observed something very peculiar. They'll always tell me that my periods don't come on the same date. So that's something which is a misconception. आपके periods calendar date के हिसाब से नहीं आते, वो अपने cycle के हिसाब से आते हैं. They come after a fixed number of days.
Like 30,
some girls will say
35,
कि
yes.
Yes. Exactly. Some girls will say मेरी date 2 दिन पहले आ जाती है हमेशा, 2 दिन बाद आ जाती है. So they are very concerned.
That means the
with the date.
cycle is
Why doesn't it
28
come on a
days.
date? So let's first, so let's stop calling periods a date, right? And what we need to know is कितने दिनों बाद cycle आ रहा है. So if your cycle is getting repeated after every 24 days, 27 days, 28 days, 35 days, it's still a regular cycle. Because it's doing what it's supposed to do. It's following your hormonal cycle, which is internal to you and unique to you. So हमें क्या करना है, हमें 3 महीने तक अपने periods की dates लिखकर ये देखना है कि एक दिन की bleeding जो शुरू हुई थी और next month की bleeding, उनके बीच में कितना interval था, कितने दिन का अंतर था between the first day of bleeding of one cycle and next day, and consistently do this for 3 months and see अगर वो अंतर same है. अगर वो 28 दिन के बाद ही आती हैं या 30 दिन या फिर 40 डेज के बाद ही आपके पीरियड्स आ रहे हैं, that's still a regular cycle. Irregular cycle means that they don't follow a consistent pattern. कभी 20 दिन में आ रहे हैं, कभी 15 दिन में आ रहे हैं, कभी 40 डेज में आ रहे हैं, कभी 2 महीने बाद आ रहे हैं, कभी अर्ली आ रहे हैं, एक ही महीने में 2 बार आ रहे हैं. So इस तरह का पैटर्न अगर आता है तो number 1, this is irregular period. Second thing, irregular periods doesn't mean you definitely have PCOD. This again has become a thing these days. Anytime a girl feels my periods are irregular, I have PCOD. In fact, I'll tell you, in my clinics, I see patients who come directly and say, I have PCOD. They come with the diagnosis. Ab tell
I'm
me
telling
kya
you,
karu?
it's in everything. People are having pimples, I have PCOD. Hair growth, I have PCOS. It's like the commonest term now. It's become like the diabetes of youngsters or young women.
Absolutely. बहुत अच्छी चीज है कि awareness है. This means जिसको सच में PCOD होगा, she will take treatment early, right? So it's very good that we are aware of these terms, but self-diagnosis नहीं करना है. PCOD or PCOS, number 1, not much major difference these days, irrespective of what term you are using. But the diagnosis involves a combination of symptoms and ultrasound and blood work. So एक डॉक्टर सिर्फ आपके सिम्टम्स के बेसिस पे आपको PCOS नहीं डायग्नोज करता. They will always offer you an additional ultrasound and some blood work to see hormonal levels and then judge. क्योंकि हो सकता है कि मेरे periods irregular मेरी थायराइड की वजह से हैं और मेरे पिंपल्स आ रहे हैं क्योंकि मेरी ऑयली स्किन है. जरूरी नहीं है कि दोनों चीजें PCOS से ही लिंक्ड हो. तो डायग्नोसिस हमें खुद नहीं करना है, पर इरेगुलर पीरियड्स अगर आपने आइडेंटिफाई कर लिए हैं कि हाँ वाकई में ये बाय डेफिनेशन इरेगुलर पीरियड्स हैं, see your doctor, let them diagnose, let them give
The
you
reason
treatment.
for it.
And most often for the youngsters, I feel stress these days has become a reason. In fact, the stress of cycle not coming itself delays periods.
Exactly.
Right? So,
the moment you
stress,
start thinking periods nahi hai, aate nahi hai. It's a yeah, you're right. So it's the
absolutely.
stress of.
So periods को मतलब इतना stress मत लो. Periods आने ना आने का. Definitely, if you are sexually active and you've missed your cycle, do take a UPT as soon as you miss your periods. But otherwise, relax and see your doctor. Let them do the diagnosis. उन्होंने इतनी पढ़ाई किस लिए की है? उन्हें करना दो ना काम.
Okay, and now let's sum it up before we take the questions. What are the ways to maintain good menstruation or good menstrual hygiene or general hygiene related to probably our private part? So what would you say is the best way to maintain?
Okay, so intimate health या intimate hygiene की अगर हम बात करेंगे, number 1, always use the right products, hygienic products, and in a hygienic way. Like I said, आप हो सकता है बहुत अच्छे क्वालिटी का सैनिटरी नैपकिन यूज कर रहे हो पर आप उसे 12 घंटे लगा के रखते हैं क्योंकि फ्लो नहीं है मेरा इतना. That's also wrong. So using the right products in right way is very important. Second, over hygiene is as bad as under hygiene. अगर हम अपने इंटीमेट एरियाज को क्लीन नहीं रखते हैं, दैट इज ऑल्सो अ प्रॉब्लम. बट मैं बार बार जाकर क्लीनिंग करती हूँ, दैट इज इक्वली अ प्रॉब्लम, बिकॉज जो हमारा ये वेजाइनल एरिया अंदर से होता है, इट डज नॉट नीड एनी क्लीनिंग. देयर इज नो नीड टू वॉश द वेजाइना इंटरनली. अंदर फिंगर्स डाल के डूशिंग करने की जरूरत नहीं है. दिस इज अ सेल्फ क्लीनिंग ऑर्गन. इसके अंदर ग्लैंड्स होते हैं, जो आप डिस्चार्ज अपना देखती हैं, वो इसको क्लीन करने के लिए ही होता है. So that's a self-cleaning organ. When you are cleaning yourself, if you are using intimate washes, just wash the outer intimate areas or the vulval areas, and always clean yourself front to back. चाहे नहाते वक्त, चाहे washroom जाने के बाद, if you're cleaning yourself or wiping yourself with the tissue paper or with the intimate wipe, always clean yourself front to back. So that's second thing. And third thing I would say, that if you have any doubts कि मुझे कोई प्रॉब्लम हो रही है, whether it is excessive white discharge जैसे आजकल बहुत लोग कंप्लेंट करते हैं, or if you feel that something is wrong somewhere, then Google search से better होगा that just take a consultation with the doctor. If you are concerned that ये बहुत intimate चीज़ है या मुझे शर्म आएगी बात करने के लिए, आज की डेट में आप ऑनलाइन कंसल्टेशंस कर सकते हैं गायनोकोलॉजिस्ट के साथ, डॉक्टर्स के साथ, which are very stigma free, private. So do consult with the doctor if you feel something is off somewhere. Chances हैं कि आप अपने दिमाग में ज्यादा घबराए हुए थे और डॉक्टर से बात करके 2 मिनट में वो प्रॉब्लम सॉल्व हो जाएगी, rather than आप गूगल सर्च करते रहेंगे और वहां पर ऐसी ऐसी बातें आ जाएंगी जो आपको लगेगा कि ये क्या हो गया मेरे साथ. So better है किसी प्रोफेशनल से बात करें rather than deciding for yourself.
Like someone is asked, ma'am, periods regularly आते तो क्या करें? आप कुछ नहीं कर सकते. You will have to go visit a gynac and probably understand कि क्यों late आ रहे हैं, and then probably get them regulated. Okay.
Right.
So I think we've done our set of questions, and there are a lot more questions waiting on the chat box. So we'll quickly take them. One of the question is it okay if your periods are not syncing with the moon? Again, I'm not really clear what the question indicates. If you can understand it better.
Okay, so the moon cycle, traditionally it is believed that just like moon has a 28-day cycle, similarly us women have also been designed to have a 28-day cycle, right? So a lot of women do feel that my cycle should sync in with the moon cycle. But somewhere I think जरूरी नहीं है कि ऐसा हो. One, because आप हर वक्त आपका जो डेट ऑफ बर्थ है या आपका जो पीरियड स्टार्टिंग का मंथ है या आपकी प्रेगनेंसी है, वो सब जरूरी नहीं है कि हर वक्त मून साइकिल के हिसाब से अलाइंड चल रहा हो. द साइकिल अलाइनमेंट इज मोर इन लाइन विद हाउ योर हार्मोन्स आर बिहेविंग. So no need to panic if it is not aligning with the moon cycle. It's absolutely fine.
Now comes to like a plethora of questions on menstrual cups. So are there any other shapes available? Someone asked, there's a Z shape that has come out now, or is there only the one that you showed us?
There are many shapes of menstrual cups. The basic purpose is the same. There would be a cup with a body like this. There would be a rim. There would be these 4 air holes on the top, if you can see these holes.
Yes.
There'll be 4, in some cups will be 2, and then there will be a stem, in some there will be a ring. In some cups there is slight inclination at the top, some have a more bulge here. So a lot of variety of cups do exist, and this is basically depending upon what the inventor or the manufacturer of the cup feels might be more comfortable to some women. There are some cups which don't have a stem at all, some which have a very long stem that you can cut according to your length. So it is more to do with having options and choices for women, and you can of course take the call, but ऐसा नहीं है कि ये cup versus कोई और cup आपकी anatomy के लिए ज़्यादा suitable है. There's nothing like this. So any cup you can choose and start with, and then if you feel like, you can experiment and have more options.
Someone is saying it's very good, but मुझे समझ नहीं आता है कैसे use करूँ, डर लगता है. So अब डरने की जरूरत नहीं है, because I think the doctor explained it very very well, step wise कि इसको कैसे use करना. Anything that you would add to that, कि कोई अपना डर कैसे निकाले if they have like a fear?
So from Sirona side, if you go to our YouTube channel, you will see me, lots and lots of me in the expert section. We have created video tutorials that you can follow and insert the cups. We also do a monthly webinar that you can register for. in which we just demonstrate how to use cups and troubleshoot any issues. तो उस webinar में वो ladies भी वापस आती हैं जिन्होंने एक बार use किया and now they have follow-up queries. So you can register for one of those detailed sessions जो सिर्फ cup insertion और removal की बात करते हैं. वहाँ पे हम और periods के बारे में discuss नहीं करते. So lots of options, and otherwise we also have women reaching back to us through our helpline numbers, and we do help them with their individual queries also.
Okay, and now the next question is that someone has written, they feel it's disgusting to, probably remove it and then wash it and then keep it for a month and then reuse it. So anything that you would like to say on that?
Yeah, absolutely. So दो चीजें I think हमारे कहीं ना कहीं culture का part बन गई हैं. One, that our intimate area is dirty and rest of the body is somehow cleaner. Second, that menstrual blood should not be touched. It is dirty blood. अगर ये मेरी body से बाहर नहीं निकलेगा तो मेरे अंदर health problems आ जाएंगी. So both the things are wrong. In fact, your vulva needs to be the cleanest part of your body, because this is that's why I said clean it front to back, not back to front. We don't want bacteria from the anal area reaching the urethral and the vaginal area. So vulval area is supposed to be the cleanest part. Medically जब हम clean करते हैं किसी को तो हमेशा center to out इसीलिए करते हैं because vulva is supposed to be the cleanest. Second is menstrual flow, like I just described. जो हम blood periods का देखते हैं वो endometrial lining होती है, वो हमारे नसों का खून नहीं होता है. And this endometrial lining अगर pregnancy हो जाती है तो इसी के अंदर एक नई life का birth होता है. तो जो menstrual flow बाहर आ रहा है वो जन्म का source है, एक नई लाइफ का सोर्स बनने वाला है, वहीं से वो पहली न्यूट्रिशन लेता है. तो उससे ज्यादा प्योर कोई चीज नहीं हो सकती. एंड थर्ड, द फीलिंग ऑफ बीइंग डिस्गस्टेड एट इंसर्टिंग समथिंग एंड टेकिंग इट आउट, once you realize the convenience of a cup, that once you insert that cup for the first time and you have no leakage and you are so free, this is when you realize कि ये disgusting नहीं है. In fact, any woman using a cup comfortably will never go back to pads because the convenience is the ultimate answer. Uske baad it no longer remains about the environment, about the money. It becomes ki this is my primary choice because this is convenient.
It's so convenient. So someone has asked, is it safe for heavy flow? Yes, in fact, it is recommended for heavy flow. That's what we've discussed. It's the most convenient thing to use for heavy flow.
Very, very heavy flow. You can even use the large size of cup. So cup comes in 3 sizes. This is the medium, most commonly used one. Then this is the large and this is the small. If you're confused about your size, you can just go to Sirona website. There's a cup size calculator. Put in information about yourself. You'll get your right cup size. वहाँ पर flow के questions included हैं.
Okay. The next question is, how long should a cup be used? What is the lifespan of a cup?
As per the manufacturer of the cup, the shelf life is 10 years. But we know of women who have used it longer than that also. But right now, I would say up to 10 years, depending upon how well you are maintaining it. Minimum that it can be used for is at least 5 years.
Really?
Definitely.
Like the same cup for like 10 years?
I have used mine for 4+ years already. It's exactly in the same shape.
Hey, this is like a revolution. I mean, I don't know why it's not like out there. I'm glad that Sirona is actually putting this out there for everyone to see and know. Even I didn't know, yeah, 10 years is like amazing.
It is. It actually is. And like I told you, it's the ultimate convenience. And once you experience that कि periods हैं और नहीं feel हो रहे कि periods हैं, तो nothing like it. Because ultimately periods ही आपकी एक interruption बनते हैं सबसे बड़े. So
and it's not at all painful in any way. Not at all. You have not had any bad reporting cases. What have people done wrong with it? Nothing?
What people have done wrong with it, one which I feel is not storing it properly. Like some people, they leave it in the bathroom. So that's not supposed to be done. If you are using a cup, you wash it at the end of your cycle. There's a jute bag given with it. So you put the cup in the jute bag, store it with your undergarments. Don't store it in a moist space.
They made it so easy for you guys. You go for select your size, order it, you use it. They've given you a wash to wash it. They've given you a bag to keep it. What else do you need? This is like the complete package right given to you in your hand. It's like everything is right there in front of us to use. Super convenient and super amazing. I love this whole concept. The next question is, let's move away from menstrual cups to take two other questions. Someone is asking that my normal cycle is only 2 to 3 days. Is it okay? Because while most women bleed for 5 to 7 days, someone is bleeding just for 2 to 3 days. So is it something to worry about?
Okay, not exactly something to worry about. 2 to 3 day cycle means you're bleeding less. The commonest reason for this in our country would be anemia. तो अगर आपका hemoglobin कम चलता है और आपको ये पता है, then taking iron supplements on your own will also solve it. Add iron in your diet. All women should always keep in mind that हम लोग क्योंकि bleed करते हैं, we should always keep our hemoglobin tested every 6 months to 1 year, and we should be taking iron supplements also. या डाइट में हम आयरन रिच खाना ले सकते हैं, बट अदर देन दैट इफ यू हैव हाइपोथायरॉइडिज्म तब भी साइकिल आपका कम हो जाएगा. सो अगर अनीमिया रीजन नहीं लगता आपको, just meet your doctor and they can just ask you a bunch of questions and हमें उसी से इंडिकेशन लग जाता है कि क्या रीजन होगा.
And someone has asked that they have a lot of white discharge. So is it something to worry about, and what should be done about it?
I'll tell you very briefly. Lots of white discharge, which is non-foul smelling, जिसमें बदबू नहीं है, जिसमें खून के धब्बे नहीं है, जिसमें झाग नहीं है, जो कि दही की तरह फटा नहीं है, is normal. It's normal physiological discharge and very important. Recently, I've been asked by a lot of newly married girls that after marriage, I suddenly have a lot more discharge. This is all normal because this discharge is giving you the lubrication that you need. So, and it is cleaning your vagina internally. So physiological discharge is normal, and some amount of vaginal odor, थोड़ा सा smell जो tolerable हो आपके अपने लिए, that's normal. But any time your vaginal discharge changes color, अगर वो दही की तरह फटा सा आता है, या फिर उसके अंदर आपको ब्लड के धब्बे दिख रहे हैं, हरा दिख रहा है, झाग दिख रही है, या इतनी बदबू है उसमें कि आपसे खुद बर्दाश्त नहीं हो रही, मीट योर डॉक्टर. एंड घबराने की जरूरत नहीं है. कई लेडीज इंस्पेक्शन से या मेरे को एग्जामिनेशन कराना पड़ेगा उससे भी घबराती हैं. आज की डेट में बहुत अच्छी गाइडलाइंस हैं जिसके बेसिस पे जस्ट आपके सिम्टम्स पूछ के भी आपके डॉक्टर्स आपको मेडिकेशन दे सकते हैं.
Great. The next question is cup size related to cervix position?
नहीं, not entirely, because cervix की position, cervix एक बात तो fixed नहीं होता. Yes, according to your height, your vaginal canal length will be different. So yes, some women do have lower cervix as compared to other, and some have higher cervix compared to other. But cervix in a as a woman also, my cervix can move up when I'm aroused. So that's a different thing. But the cup size is not basis the cervical length, but basis certain other features, mainly your age and whether you have delivered vaginally or through cesarean section. अगर आपका बेबी है या नहीं हुआ है, and second आपकी एज क्या है, यही दो मेजर फैक्टर्स हैं. सर्विक्स अगर आपका मान लेते हैं सर्विक्स यहाँ पर है, तो ये कप यहाँ इंसर्ट करके अगर स्टेम बाहर आ रही है तो हम स्टेम को कट करने की एडवाइस देते हैं. दैट्स ऑल. बट कप साइज सर्वाइकल लेंथ से रिलेशन है, बट बहुत स्ट्रॉन्ग रिलेशन नहीं है.
Okay. And is Sirona menstrual cup safe to use in conditions like diabetes? And are there any precautions that need to be taken for diabetics?
Okay. So number one, if you are diabetic, then in general, your sugar should always be under control, because people who have diabetes and women who have diabetes, they are more prone to any infection, and particularly vaginal infections and vaginal fungal infections. So make sure that as a diabetic, if you are using cup, again, nails hamare cut hone chahiye, hands wash hone chahiye, and do sterilize the cup before you insert it. And you do have this steam sterilizer, जिसमें कुछ भी नहीं करना पड़ता, 1 चम्मच पानी डाल के you just put the cup and you turn it on, and within 2 minutes the cup gets sterilized. Or you have this microwavable container also, जिसमें you just open it, put some water in it, put the cup in it, and you close it and you put it in microwave for 1 minute and it is sterilized. So sterilization के भी बहुत easy तरीके हैं आज की डेट में.
So can you just boil it?
तो just एक cup. That's what I'm saying, that boiling बहुत ज़्यादा fuel use होगा. So you can just clean the cup एक बार, put it somewhere, and उसके ऊपर उबलता हुआ पानी अगर आप डाल दोगे, so that will also sterilize according to one very latest study. So that's also okay, but otherwise ज़्यादा convenient method है. I've been using this from starting, so this is most convenient to me personally.
Great, because of 10 साल चलाना है तो you need something जो साथ में मतलब supports you that way. ठीक है. And is a menstrual cup safe to use at night time also? No, nothing to worry.
Nothing to worry, you can use it. मतलब मैं बार बार अपने सेशंस में ये बोलती हूँ कि मुझे आज तक ऐसी अब लेडीज मिलती नहीं है जो 10 घंटे सो रही हूँ. 6 घंटे में तो हम उठ ही जाते हैं. तो प्रॉब्लम कप अगर इंसर्ट करके 12 घंटे आप सोने वाले हो तो डेफिनेटली प्रॉब्लम है. इतना लंबा आपको कप अंदर नहीं रखना है. उससे पहले आई थिंक एक बार तो वॉशरूम जाने के लिए उठना ही पड़ेगा. देन जस्ट रिमूव एंड एम्प्टी करके रीइंसर्ट कर लीजिए. अगर इनकन्वीनियंट लगता है देन अनदर सस्टेनेबल ऑप्शन वुड बी अ रियूजेबल क्लॉथ नैपकिन. सो रात को आप रियूजेबल क्लॉथ नैपकिन भी यूज कर सकते हैं सोते वक्त. दैट्स आल्सो सस्टेनेबल. 2 से 3 साल तक दिस कैन आल्सो बी रीयूज्ड.
Great. Okay, someone is asking, they get a lot of white discharge and itching भी होती है. So ma'am, itching है तो you'll have to probably see, like that's what she said. Any discharge which is foul odor or a different color from normal or is itchy,
I would
you
suggest
need to see a gynac or a professional for it.
Right. And if there's no foul smell but itching is there, then the first thing that you can try probably is just clean yourself every morning when you're taking the bath and allow some airing, which means अगर आप घर में बाहर नहीं जा रहे हैं तो अंडरवेयर कुछ घंटों के लिए नहीं पहने. allow airing of the area. and उसके बाद भी अगर itching बहुत ज्यादा रहती है, especially I've seen women जो कि bikini area में अगर razors बहुत ज्यादा यूज कर रही हैं, which is okay to use, but fresh hair जब आते हैं तब भी itching होती है. तो अगर वो temporary phase है itching का just, then it's okay. But otherwise वो persistently रहता है और आप दिन भर आराम से बैठ भी नहीं पा रही हैं और इतनी itching हो रही है, then see a gynecologist.
And another question is, every morning, mostly, not always, when I wake up, there's some light pain in the vagina. So is it something to worry about?
See, for answering this question, I would need more information. So if it's okay, you can DM us and we can go one-on-one on a conversation and talk about this. This is not something which just basis this I can answer.
Okay, and let's just take one last question. How long do you have to keep it for cleaning? Like suppose आप बोल रहे हो boiling water तो चलो हमने ऊपर से डाल दिया and it's done. If you're using a sterilizer, how much time? If you're using any other method, how long do you?
स्टरलाइजर में ये बटन होता है. सो व्हेन आई प्लग इट इन एंड आई टर्न इट ऑन, ये रेड लाइट ऑन होके 2 मिनट में या 3 मिनट में अपने आप ऑफ हो जाती है जब स्टीम अपना काम कर लेती है. सो दिस इज ऑटो कट ऑफ 2 to 3 minutes. And this you can keep it from 1 to 2 minutes depending upon the power of your microwave. So and we no longer recommend that आप boiling water में डालें, but अगर आपने boiling से ही sterilization करनी है, if you somewhere in your head feel better about it psychologically, then bring the water to roll boil, put the cup in it for 7 minutes and then turn off the gas. That will sterilize the cup.
Great, wonderful. There are a lot more questions, but I think we've taken pretty much everything. They're all on the same lines. So I think we've pretty much covered everything. And now, first, I would really like to thank you. Thank you, thank Sirona, thank BabyChakra, because even though it was a topic I've read so much about, I've heard, I didn't know so many things that you told us today. So it was definitely super, super insightful. And we would really like to thank you, Dr. Diksha, and of course, sum up the whole session in whatever you would like women all across this platform to know.
First of all, thank you so much. It is always a pleasure for me to, come to platforms like this to discuss women's health. Honestly, I feel that especially हमारे country की ladies, they always put themselves second. As mothers, as women of the house, we always care about others. हम सबका ध्यान रख लेंगे, अपना ध्यान सबसे end में रखते हैं. तो my one piece of advice would be invest in yourself also. हम YouTube videos कितनी तो देखते हैं ना. Also see videos which are related to your health and especially your intimate health. And do invest in yourself also. अपने आप को भी time दीजिए, अपने ऊपर भी ध्यान दीजिए, ताकि you can also have a healthy life.
Thank you so much, everyone, all you wonderful women who gave us an hour of their day today, of their busy schedule, and helped us make this session super successful. I think it was very insightful, very informative to everyone out there. So I'm really thankful to the entire team who's put up this webinar for us. And thank you so much, guys. Any more questions? Feel free to follow Sirona, DM them with your queries. Please follow BabyChakra as well for more updates, more webinars, and for more such insightful sessions. And hope to see you all soon again. Thank you so much. I think, can we wrap this up, Anaga and Nayana?
Yes, Nimita, we
Thank you
can do
so
that.
much. Thank you.